Hello, Dr. Williams. Welcome to Wake Up with Marci.
Thank you so much, Marci, for having me on. It's great to be with you today.
It's really wonderful to have you on, and we're going to be talking about a subject that sometimes makes people a little uncomfortable. And I want to get down to it. So you're the author of This Is How You Vagina. And I want to talk to you really about why you decided to write this book and why it was so important to you.
I'm so glad you asked that question, Marci. It's really important to me as an OBGYN and vagina health advocate to make sure that my patients understand everything there is to know about what is normal about their vaginas. I have so many patients, and everybody has so many myths and misconceptions that have been ingrained in them for so many years. And during the pandemic, I had a little time on my hands, and I decided to write this for my patients.
Yeah. So tell us a little bit, first of all, I love how you have the history and, then you delve into a lot, obviously, about the vagina. And, listen, the fact that it's so taboo is, it's kind of a little disturbing that we can't talk about it. No, there's a lot of issues that women have and they don't talk about it because they're uncomfortable. So let's talk a little bit about what we're going to find in your book.
You're going to find a lot of information and historical references. And the reason that I actually included these little historical tidbits is to let women know, and all vagina owners know, that this is nothing new under the sun, that our vaginas have been berated and castigated and as seen as something that is terrible and awful and needed to be tamed for literally millennia. And that we in a modern society can take this knowledge and information and go, you know what? We should be different.
Right. So let's talk about the most asked questions you get.
The most asked question, oddly enough, for my patients is, Doctor, am I normal? Is there anything wrong with me? And most of the time, now, of course, there are disease states that can happen, and we do talk about that, but I want to promote what is actually normal about the vagina. And most of the time, my patients' vaginas are normal. Now, they might need a little tweaking. They might need to hydrate better or not need to stifle her by wearing leggings all the time. But these are very small things.
So let's talk about some common myths and misinformation that we get.
So one of the common myths that I do want my patients to unlearn is that everything that happens to us isn't somehow due to our lady parts, isn't always secondary to hormones. Sometimes women just get angry because we're human beings. And my historical reference for that is that way back, and this is not way back because we have written history, is that people thought that the uterus was an animal that moved around the body and caused problems. So if a woman had a headache, they thought that the uterus moved to her head and they needed to lure the uterus back like it was like a wild beast back to this area. And they would give her bad things to smell up here and put fragrant herbs down there to move it back. And I really think that we have become slave to what we think our hormones are doing all the time. And yes, they play a role, but most of the time we're just human too.
We are human. That's so true. I'm glad you said that. Because we are, I don't know, I got it a lot. And I know that I was very affected by perimenopause, menopause.
Yes.
But we are human too. I mean, we're allowed to be affected by things.
Yes, we are affected by our hormones, but we're still people and we're subject to normal people issues.
So let's talk about you. I mean, you're so focused on empowering women and it's so important to you. And so let's talk about how we can be empowered and feel more comfortable with this subject. I want to emphasize that, more comfortable.
About that. Yes, thank you so much. So one of the things that is super important to me is if you look at the title, All About the Vajayjay and why you probably shouldn't call it that. I want us to become comfortable using the word vagina. And I actually break it down like the dictionary in the book, as well as some of the other more common terms that we use for the vagina. Because when we call a thing what it is, the proper term, we understand why that term exists, then we can move forward and be empowered because we know our name, and our name is vagina. It's not vajayjay, it's not cooch or some other little cutesy term. Now, if you decide to have your own special name for your own very special vagina, that is empowering to me, absolutely. But when we denigrate her and we call her outside of her name as a comical thing or to make fun of it, and of course, other genders do tend to make fun of our vaginas as well,
Yeah.
that means we're not able to move forward. So call a thing what it is. She is
Yeah.
powerful. She's beautiful. She's vagina.
I think a lot of times that we make up the names because we're uncomfortable. So, you are trying to empower us to be comfortable with that. And just like anything, the more we talk about it, the more we break
Right.
the stigma about why there has to be a stigma behind the vagina. But, we break that
Exactly. The more
and
we talk
become more
about, the more
comfortable.
normal it becomes.
We normalize it. Exactly.
Yeah.
So where can we find you and your book?
So you can find my book at www.thisishowyouvagina.com. However, shout out to local bookstores. Go to your local bookstore, walk in, ask for the book, browse around. The book should be on the shelves.
Very good. Well, so happy for you, and thank you for all that you are doing for us women.
Thank you so much, Marci. It was great to be here.
Bye-bye.